Hello, my name is Dr. Francis Omari from City Health Hospital. It's my pleasure today to have the opportunity to introduce who we are at City Health Hospital. So the first thing that I'll start by doing is perhaps to explain where we are located. So City Health Hospital is located in Tomboya Street, Odeon Cinema building. We are in the second floor of the same. When you come to Odeon Cinema building, the very first thing that you will find, you'll be able to see City Health Hospital. So once you are at City Health Hospital, I would like to take a minute to explain the different things that we do. And as we go from one station to the other, we'll perhaps be able to fill out the different parts as we go by. But one of the first things that I want to maybe take your attention to is to do a shoot. That will be able to show you guys what it is that we do, because we do more or less just about everything in as much as outpatient patient care is concerned. We do general consultancy, we do specialized consultancies, we do what you'd call minor surgeries as well. We do, whether it is radiology-based investigations, we have laboratory-based investigations. So I'll be able to take you through the different stations and maybe just fill out more information as we go by, based on the different stations as we go by. At City Health Hospital, once you are in through the doors, the first station that you'll always interact with is going to be the reception area. And we'll do just a small shot of the same. So this is our reception area, and you can see one of our people is currently manning that space. So from the reception is more or less where you get the different information based on what has brought you in, and they are able to guide you into the different departments. Say, for example, if you've been referred in by a doctor, what you need to have done is an x-ray or something like that. They are able to coordinate that for you. If it is that you've come in to see the different doctors, whether it is at general sort of consultancy level, or if it's specialized consultancy levels, bookings, there are different informations that one might need as a patient or one might need as a client per se. You will be able to find all that from the reception desk. Yeah? From the reception, you find that one of the stations that usually you'll start by more often than not is what you call the triage space. And the triage space is usually manned by our nurses. I'll take a minute just to maybe introduce one of our nurses that we have with us. She's called Abigail. You can say hi. All right. So at the triage level, of course, what is primarily usually done is the nurses will try to extract the information based on the different complaints that have brought you in. And they are able to facilitate for maybe checking what we call vital taking, things like blood pressure. They're able to do the blood sugars where it is necessary. They're able to take your weight and height in regards to what we call the BMI scale and all that, yeah? But you also find that as a nursing station, they usually are able to facilitate for the ANC clinics as well as the well child clinic as well, yeah? So you are always welcome at any particular time that you find that you have a need for any of those particular services. And I've almost forgot, you also have, they are in charge of vaccination and all these things. So if you have a need that is vaccine related, they are also the people that are in charge, and they're able to take care of you well in, yeah? So for the triage spot, you'll always find that the nurses will now be able to push you to the different doctors that you're supposed to be reviewed by. So I'll take a minute to take you through the consultation rooms. This is maybe a shot for the same. This is one of our consultation rooms where you find that every other day we have doctors around. We have different departments for that, as I actually alluded to first of all. More often than not, of course not more often than not, but we always have the general consultancy running from Monday through to Sunday. So every day of the week, we have doctors available. So if you need to be in, maybe you need to check into hospital, opening times are usually from 7 in the morning to 8 p.m., other than on Sunday, in which case we usually open from 10 a.m. to 4 p.m., all right? So if it's not general consultancy, of course you find that your need might be gynecology, because we also have the specialized clinics. We have the gynecology clinic, we have the urologist clinic, We have the physiotherapy clinic. We have what you call the ENT clinic. We have surgical as well, all right? That is general surgery. We have all these different specialized clinics per se. So anytime you've come in, if it is not that you've come in for general consultancy, you'll always be able to be guided to the different rooms. For example, I'll take a minute to just take you through the ENT office and show you some of the machines that we have in place for that. All right, so this is the ENT space, and you can see there's an ENT machine there, okay, that is able to take care of most of the needs in as far as outpatient is concerned. Of course, if you need further review, if you need further surgical operations that need an open, like a bigger theater space, that still can be coordinated. So if you have an ENT need, we encourage you to come because your needs will be met and will be met fully, okay? Okay, so I'm currently standing in the optical department. Just to maybe highlight one of the other services that we provide. We have an optical department run by optometrists. We have the facility actually fully furnished in regards to machines, and you can see that we also have quite a wide range of the spectacles on display. So again, if the need that has brought you to hospital is eye related, maybe you're having eye pain consistently, you are consistently having irritations to do with the eyes and all these things. And surprisingly, you'll find that one of the commonest causes of what you call recurrent headaches is actually optical related. So in case you've been wondering, in case you've been having a headache that just won't go away, one of the first things that we'll always advise you is make time to come and get your eyes checked. You'll always find more often than not, the answer is always optical related. So if you've been having one of those issues whereby the headaches are just persistent, you've tried different painkillers, you've tried all these other reviews and nothing is giving, so find time. At City Health Hospital, we have a fully functional optical department. They're able to review, and if in case it is found that actually what is been affecting you is optical related, they will be able to take care of that. The other department that we have on board, we have a dental unit. We have a fully functional dental unit with the services that are usually running from Monday through to Saturday. And again, as I earlier on mentioned, we usually have the place open from 7 in the morning all the way to 8 p.m. So if you have a dental need, you can always find time to pass by. We'd still be able to take care of that. I'll just do a brief show of the dental space. We have a fully sort of set up place for that. We have a dental machine, of course, a dental chair, as you can see. We have one of our dentists around, so maybe she can just say hi. And I'll leave it at that because she looks as though she's a bit busy. But if you have a dental need, whether it is you think it's a tooth extraction issue, whether it's a filling that needs to be done, whether it is cleaning, all these things, because one of the, you find that things like teeth staining is something that is extremely common. And let me surprise you, one of the first things that, or rather, not once really, twice in a year, you should have actually had your teeth cleaned out, right? So if you've never had one of those things done, please find time. Pass by the dental. It's not painful. They have things to ensure that the experience is wholesome and the experience is nice. So don't shy away from that. If what you actually need is a dental service, please find time. As I said, from Monday through to Saturday, they are always in and they are able to take care of whatever dental need that you would have. So last but not least, we have the pharmacy department. So once you've been through the different departments of the facility, you find that maybe you've had your consultation done, you've had your investigations done, whether that was a radiology-based investigation or lab-based investigations, or you've been to the dental department, optical, gynecology department, ENT, whatever department that you might have visited in the premise of the facility, then more often than not, you'll find that the last station that you'll come to is usually the pharmacy. And we have all the different medications that you would need. It's a fully stocked out pharmacy. So in case what you need is medications, you can always find time to come in. And by the way, even as I walk in without needing to have gone through the different departments, maybe you already know what it is you need. You have a prescription with you. You can still find time to come through. They'll be able to source and they'll be able to give you the different medications that you might be looking for. As a summary of sorts, I would say we have been able to take you through the different things that we do in our hospital, that is City Health Hospital, to the effect of it being, in as far as outpatient is concerned, we can guarantee you that we'll always be able to meet that reaches your desire, because us as a facility, what we go for is to make sure that we are patient-centered. We're able to offer you high-quality services and at a reasonable cost. And as we speak of reasonable cost, you find that we have different modalities of payments. We have one of the primary ways that we have the payments done is by M-Pesa. And then we have, of course, insurances as well. We have NHIF, whether that's national scheme, whether that's Kenya Police Services, whether that's for what we call civil servants. We have all those schemes on board. We also have corporate schemes from different insurances as well. We have the CIC, we have UAP, we have Fast Assurance, amongst other corporate schemes. So if what you need to be attended to is going to be something that requires you to use your insurance card, don't feel like you're left out, because we are able to have all these things factored in. So please find time. And I would want to say you are most welcome to City Health Hospital. Have a lovely time.